Sometimes we use words kind of casually and then take a minute to really step back and think about, is what we're saying making sense in the way we want it to? Well, one of those phrases is hearing loss. How often do you hear someone say, oh yeah, he struggles with hearing loss, or I don't think I have hearing loss? Maybe that's accurate, and maybe it isn't. Dr. Tiffany Ahlberg joins us this morning. She has Ahlberg Audiology up in Cleveland. Good to see you.
Good to see you too, Julie.
So I guess probably the way it works is more often than not, someone says to you, I don't have hearing loss, but the truth is they may.
Yeah, so a lot of times it's very, very common. It happens several times a week. People will come in and I will explain their hearing test results to them, and they'll say, but that doesn't make any sense. I'm not deaf. I still can hear. And I think we use a blanket term of hearing loss, and I was hoping to explain that a little bit better. I think sometimes a better way to explain that is sound voids. So if you think about the human ear and all of the different tones that our brain is perceiving from the cochlea and how it's tonotopically laid out, then if you had a piano and maybe a third of the keys didn't work, so maybe just the keys on the right-hand side of the piano didn't work, but you had all the rest of the keys that were functioning properly, and you played a song like that, it would sound different. It's not that you're not hearing the song, it's just that the song may not make sense. It may take your brain a little bit longer to identify what that song is because of a void of certain sounds that you're not perceiving.
When you mentioned that to me, I'm a visual thinker, I guess. So the first thing I thought of was that little exercise people have probably seen where you remove the vowels from words, but you can still figure it out. So you can read that way, but it's harder. So does that speak then, Tiffany, to the connection between your brain and your hearing, your brain and your vision? It can adapt, but it strains things.
That is the best analogy, yes. That is exactly what happens. Our brain it's like playing Wheel of Fortune, and you're only getting a few of the letters, and your brain can fill them in, but it takes a little longer. And so when people are having to do that all day, there's a strain, a mental strain at the end of the day. So people are able, a lot of times people will say, I hear just fine. I have no trouble hearing. I just can't understand. And a lot of the times the sounds that they will tell me that they hear just fine is a car going down the street. They can hear it a mile away, or a knock on the door, something with some vibration, because those are bass sounds, and people tend a lot of times to have better hearing for those frequencies. And the sounds that they may be missing may be the oven timer going off, or the microwave timer going off, or maybe the phone ringing from like a room away, something that maybe other people are perceiving but they're not. And those sounds would be our consonant sounds, like S's, CH's, T's, K's, F's. So if people are getting the vowels, O, A, E, Ah, and not the consonants, F, S, C, H, then they're having to fill in the blanks. And sometimes you just fill in the blank wrong, and then nothing else makes sense.
Okay, I know you're an audiologist, but play therapist for me for a minute, because often people come to you and they're years in denial in a way, living with this. So sometimes it's family members who've seen it first, and there's an emotional component. You feel like you're insulting someone when you bring this to light. Is it a good idea to maybe, as the family member, make notes to let the person see that you're not hearing the timer, or you're not hearing these words?
It is good. And just like anything in life, when we have people hound us about things, we become very defensive about it, and we reject those kinds of things. So there is a component to it that you have to own it. You have to be the one to admit before there's something before you can do something efficiently, effectively, before you have to commit before you're ready to heal. And so it's definitely it's okay to bring things up. I think that it's in your family member's best interest, but don't hound them about it. They have to be the one to accept it before they're ready to move on and do something about it.
You shared a phrase with us recently that really stuck with me. I loved it. And it went something like, if you're the person who struggles with hearing, maybe you can say to someone, what I heard you say was fill in the blank. And if you're the family member, you can say, were you able to hear, or how do you phrase it if you're the family member?
So if you have a hearing loss, a lot of times it's not effective or efficient to say the same thing 3 different times. So if you, as the person with hearing loss, say, I heard you say car, but I didn't hear where the car, what was the rest of it, then that person can fill in the blanks that you missed. And I mean, I know that it tries the patience of the family members that have to do that, but you have to have compassion for people that have difficulty like that. It's hard on them. It's hard on everybody. That's why I hope people pursue better hearing. I mean, it's so important to our human connection with our families and friends. But sometimes people just have to wait a little bit before they're ready to do that.
Well, okay, so we've never had a conversation like this before, really, where you kind of touched your heart like that. But you see people hurt sometimes when they come into your office. So besides the fact that you've described these sound voids and what they can really present like in your life and the compassion, let's talk about getting you then back to better hearing. It's easier than ever before, right? The options are endless now.
They are, and it's so much easier. I hear it every day that it's so much easier than people thought it was going to be. It's not as bad as people have it. You in your head, you picture something as being just awful, and you're so not ready for it. You get so emotional about the whole experience, and you don't want to do it. But when it comes down to it and people do it, I mean, they do, most of the time, people do really well if they have committed that they're ready to fix it.
And I think
that's the biggest part of the equation, is they have to be the one that's ready. It doesn't help if a family member makes them. That person that comes in has to be committed, and if they are, it's easy peasy, and it's easier than ever.
And let me ask you this too before I let you run. I know you're a big believer in the value of having a baseline hearing test. I think it's at age 50, is that right?
Age 50 is when they recommend having a baseline hearing test, and I just cannot tell you how important that really is. The amount of people that I see that feel like they've had a change or a sudden loss, or they have something going on, and if we don't have anything to compare it to, we're just guessing as to what could have happened. But if someone has a baseline, then we know without a shadow of a doubt, like, that they've had a hearing change or that something's happened. So it's very important to have that.
And then if someone does come to you and they think they have some of these sound voids, as you mentioned it, does that always necessitate a hearing device, or sometimes is it just what it is and you see?
Not always. I mean, and that's where a hearing test is the only way to know that for sure.
Okay.
It's just one of the many, reasons that that people come in for a hearing test. And so once we do the hearing test, we can determine how much hearing loss someone has, if they have a hearing loss. So there's no way to know for sure until we actually have that diagnostic test.
Well, if I was in 8th grade English class and the teacher said to me, what was the moral of the story? I think today it would be compassion. I think that's what you showed. So thank you for your time, Tiffany.
Thank you, Julie.
You will find her at Ahlberg Audiology in Cleveland. The phone number is 641-0956. Online, it's ahlbergaudiology.com, and the whole team up there, is taking new patients. So if you are looking for a chance to get a hearing test of your own, please give them a call. Thank you.
Thank you.